Welcome to YARKUD International. Today we are going to see the Saudi Prometric exam question and answer discussion. Let's see one by one. First question. When discovering a medication error, the nurse first action is to. Okay, it is very important. So what we have to do first action. Okay, so when the medication error. Okay, so call the nursing supervisor, call the physician, fill out a medication error form, assess the patient's condition. So these all answers are correct, right? We have to do after the discovering medication error, this all the things. But we have to be remember, you have to select the best one and first action. What is the best and first action? It should be always, you should consider the patient because you have given the wrong medication to the patient or wrong dosage to the patient. So what will be happen to the patient? You have to assess the patient condition. That is the first priority. Okay, got the point? So when you do the medication error, first thing you should do, assess the patient condition. Let's see the next question. So today we are going to see the different aspect, okay, from the administration, research, and from the maternity, we are going to see the question and answer. So next question is 28 years old pregnant woman at 9 weeks gestational, present with the vaginal bleeding. During assessment, the nurse found that fundal height is increased compared to the gestational age. Which of the following is the most likely diagnosis? Okay, this is the question. So here the option placenta previa, abruption, placenta, ectopic pregnancy, and hydatiform mole. Okay, so these are the options. So you have to remember here they are given the key point 9 weeks vaginal bleeding and fundal height increase comparing to the gestational. These are the very important key points. So 9 weeks, you should take the 9 weeks disease condition. Placenta previa, abruptive placenta, it is about after 20 weeks of pregnancy. So it should not become. So A, B option you can cut off. So what about the ectopic pregnancy aided from that can be possible at 9 weeks, okay? But the ectopic pregnancy, as we know, there will be the patient will be getting the tube pregnancy. The patient will get the pregnancy in the tube, not in the uterus. Okay, tube pregnancy, as we know, and there is a identiform mole. What will be considered as the abnormal tissue growth? Okay, so ectopic pregnancy, it is miscarriage, but the identiform mole, if we do, it will be the abnormally, that is a patient will be getting the growth in the uterus. Okay, so this is called the hydatiform. So you have to know the signs and symptoms. Vaginal bleeding will be come under ectopic pregnancy and hydatiform. Okay, the two. But here the next one, it is called fundal height increase compared to gestational age. Okay, it will be possible only hydatiform. Okay, fundal height usually in the normal patient, gestational age and fundal height, if you just do, fundal height will be just 1 or 2 less. Okay, but here the fundal height is increased comparing to gestational. So the answer is hydatiform mole. Okay, so one more hydatiform mole question is there. So ultrasound, in ultrasound, snowstorm appearance seen in which patient? If they ask you like that, hydatiform mole, it is answer. Okay, just remember that. Snowstorm appearance in the ultrasound. Okay, and one more thing, fundal height increase comparing to gestational. So the option B is the answer. Got the point? So let's see the next question. From the research, okay, the nurse is going to conduct a research project. What is the most important step to do? Be identified first. Okay, research problem or research setting, analyzing plan, sample size. So these all should be done, but they are asking specifically what is the first step to be identified first. Okay, doing the research. So as we know, first we should be having some problem. Okay, research problem, when you set only, you will be next doing the research setting, analyzing plan, sample size and all. So first thing what you have to do, research problem. You have to find out the research problem first. Okay, that will be starting of the research. So this is come under the research question. So answer is A, research problem. Got the point? Okay, let's see the next question. The nurse should understand that at least one dose of following vaccination is recommended for the patient after the age of 65 years. Okay, so options are varicella, influenza, hepatitis B, pneumococcal. Okay, pneumococcal vaccine. So these are the vaccine. So you have to be remember older. It is age after 65 years. There is a patients are high risk to get this disease. Then you will be easily getting the point. So older adult are high risk to complication of getting the lung problem like pneumonia. Okay, so this will cause the patient will be getting the pneumonia after the age of 65. So they must take the what vaccine to prevent the pneumonia? It is pneumococcal to prevent the lung disease. The patient after 65 years will get the pneumococcal. Got the point? So answer here is D, pneumococcal vaccine after 65 years. It is recommended. Okay, let's see the next question. In preparing the patient for the electroencephalogram, EEG, the nurse should. Okay, that is the question. So sometimes they will be just asking briefly also. The main point, this is the main point, okay? So EEG, as we know, that is we are just going to assess the brain impulse, okay? So here the options are given: withhold breakfast, give sleeping pills at the night before, shave the hair, restrict intake to coffee. Okay, so you have to be remember something is disturbing brain, you should be stop or you should be doing. Okay, because this is the brain test, EEG. So withhold breakfast or give sleeping pills at the night before, shave the hair and all not come. Okay, because the EEG test mainly they will be doing with the hair only. They just tell the patient to remove the cap, pins, metal item only. Okay, and hair with the shampoo. These are the procedure preparation. And we should be restrict intake of coffee. Why? Because caffeine will be increase the energy metabolism. Okay, so what will be happen here? Caffeine will be the vasoconstriction. That will be reducing the resting cerebral blood flow. Okay, so this reducing resting cerebral blood flow will be the problem. Okay, because we are just checking the brain impulse. So here the caffeine will be vasoconstriction, restricting the cerebral blood flow. So this will be the main point here. EEG, you have to remember we have to restrict intake of coffee at least 8 hours before. Got the point? This is the answer for this question. So if any procedure if they ask also, you have to be remember think main point what the test will be, so you can able to understand and find out the answer. Okay, here the YARKUD International, we are giving the nursing training for the all the examination. So here online training will be available for Prometric, SNB and Oman Pearson View nursing examination, MOH, DHA, HAD, OET and IELTS.